Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life in Balance. As a practicing chiropractor who does a lot of soft tissue work, knee pain is something I see a lot. And we generally do really well with knee pain. There's a couple cases that we aren't able to have an impact on, but those numbers are definitely in the minority. I've had my share of patients who were ready for knee replacement, and 6 visits later they canceled their knee replacement surgery. Now, we didn't fix the arthritis, but the arthritis wasn't necessarily what was causing the problem. All too often somebody sees something on an x-ray or an MRI and they think, oh my god, I'm doomed, and the worst thing they do is stop moving. There is nothing that you can do that is worse for our joints than actually sitting on your duff and not moving. It's a very rare scenario where movement will actually make something worse. In almost every scenario, movement makes things better. Which brings me to this particular study, which was people with degenerative, advanced structural diseases. So these are people that were going to be developing arthritis and would likely be headed for a knee replacement. There were a little over 500, so 516. The average age was 67. And they looked at how much people walked. And they found that those that just walked a very little, so 10 minutes per day at a light pace or 10 minutes per day at a very light pace, had a 35% and 37% lower risk of needing a knee replacement. Just from like 10 minutes of light walking a day, that's going to check the mail for most people. It doesn't have to be hard to save your knees, but it takes movement. And the other thing I would always recommend is finding somebody who really knows how to treat the soft tissue and the scar tissue that surrounds the knee, because just because you have arthritis doesn't mean it's what's causing the pain. You start doing the right things, and most knee conditions can get much better. And nowadays we have things like PRP, potentially for stem cells, Prolo. There are a lot of options for things that can help the knee. But you moving has to be a part of the equation. If you're not willing to be moving, then anything you're going to do is always going to be temporary. But it doesn't have to be a lot. Even from this study, we see just the slightest amount of walking can make a huge dent in your risk of needing a knee replacement. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe.